All right, so picture this.
You're just, going about your day,
Mhm.
and suddenly, bam.
Someone around you needs like serious medical help,
Yeah,
and it's on you, at least for those first few minutes,
right.
to know what to do. So
Absolutely.
that's what we're diving into today.
How to handle those critical situations.
Yeah, because those first few moments, they're crucial.
And while we'll be covering a lot today, it's important to remember
Hmm.
this is about, empowering you with knowledge,
Right.
not about replacing like actual
Right.
medical training.
Right, right.
So definitely seek that out if you, really want to be ready for anything.
Absolutely. This is like your in the meantime guide,
Exact.
practical tips, to get you started.
And to kick things off, let's talk strokes.
I feel like we hear about them all the time, but
Do we really know the sign?
that's the key, right? Because a stroke, it's like a brain attack essentially.
Okay.
And every minute, it really does count.
Wow.
It's literally time is brain.
Because when a stroke hits, what's happening is blood flow
Yeah.
to a part of the brain is cut off.
Mm-hmm.
And without that constant supply of oxygen
Right.
and nutrients,
Brain cells, they start to die.
yes, that's intense.
So, okay, if we think someone might be having a stroke,
Yeah.
what should we be looking for?
So our sources point to a few kind of telltale signs.
And a good way to remember them is the acronym FAST. So
Okay.
F,
A facial drooping.
facial drooping, okay?
Like that asymmetrical smile.
Right, right.
A, arm weakness. S, speech difficulties.
Okay.
And T, time to call 911.
Got it.
So those are your urgent red flags.
Facial drooping, arm weakness, speech problems.
It's like the body sending an SOS signal.
Exactly.
And well, a sudden like severe headache can happen
Yeah.
too.
Right.
Don't wait for that.
If you're seeing those first three signs together,
Okay.
that's your cue to act fast.
Got it.
Now, speaking of needing to act fast,
Let's shift gears to heart attacks,
I know chest pain is like,
the classic symptom.
mm-hmm.
But our sources mention it can feel like really bad indigestion too.
That's right. And it's not just random.
Those nerve pathways that send pain signals from the heart and the stomach, they actually overlap. So your it's basically sending the signal up the wrong wire, so to speak.
I never knew that about the shared nerve pathways.
That's fascinating.
So does that mean like the pain location can be misleading too?
It can. Yeah.
Well, chest pain is common.
It might radiate to the arms, the back, the jaw,
Oh, wow.
even the stomach.
That's why it's so important to pay attention to the type of pain, that intense crushing pressure,
Right.
often with shortness of breath.
Sweating, nausea.
Okay.
That's not your average indigestion.
Right, definitely not.
Okay, so those are two like
Major can't miss situations. But what about when someone's like,
struggling to breathe.
yeah,
I mean, we all
get out of breath sometimes,
Yeah.
but when does it cross the line into like,
a serious emergency.
that's a great question.
And the answer is it can be tricky.
Yeah.
Respiratory distress, as it's called.
Can stem from a whole slew of things.
Okay.
A severe allergic reaction, asthma, a lung infection.
Even heart problems can manifest this way.
Wow, really?
So how do we tell the difference?
Between, someone just needing to catch their breath and like,
The true emergency.
it's about kind of looking for those signs that go beyond,
Right.
simple exertion.
Okay.
Are they gasping for air?
Is their chest heaving?
Right.
Is their skin turning kind of pale or bluish?
Do they seem confused or disoriented?
These are all signs that their body's not getting enough oxygen.
Okay.
And in that situation, what's like the
Most important thing we can do.
without a doubt,
Call 911 immediately.
every second counts when someone's struggling to breathe.
Right.
While you're waiting for help to arrive,
Yeah.
try to keep them calm.
Loosen any tight clothing.
Okay.
And if possible,
Get them into a position that helps them breathe easier. Often sitting upright.
That makes sense.
Like maximize their air intake however you can.
Exactly.
I've heard that. Like if someone has their own like prescribed medication, like an inhaler or something,
Right.
we should help them get to it.
Absolutely.
But never administer medication yourself
Okay.
unless you are, trained to do so.
Gotcha.
Finding it for them is one thing.
But it's crucial to stay within the boundaries
Yeah.
of your own knowledge.
Okay, I'm starting to see a theme here.
Stay calm, act fast.
And know your limits.
Exactly.
So let's talk about seizures.
No, I'll admit I'm guilty of believing that old myth.
About putting something in someone's mouth during a seizure.
Yeah.
But our sources say that's a big no-no, right?
Right, yeah, forcing something into their mouth.
Can actually cause injuries,
Oh, really?
like broken teeth or jaw problems,
Wow.
and could even obstruct their airway.
Our focus should be on protecting them from harm,
Right.
not potentially causing more.
So what should we do?
If we see someone having a seizure,
The most important thing is to kind of create a safe space
okay,
around them.
cushion their fall if possible.
Right.
Remove any nearby objects they could hit, and maybe put something soft under their head to protect it.
So basically, we're like their personal safety net.
Exactly.
Is the seizure.
And contrary to popular belief,
Yeah.
you can't stop a seizure.
From happening once it started.
Oh, okay.
It has to run its course.
Our job is to make sure that course is as safe as possible.
Makes sense. Makes sense.
No fainting.
May seem, I don't know.
Less intense than a seizure,
Sure.
but it can still be, pretty scary to witness.
What are the key things to remember?
About helping someone who's fainted.
Well, one of the most common triggers for fainting
Mm-hmm.
is actually standing still for too long.
Oh, really?
It seems counterintuitive.
Okay.
But when someone faints, we want to get their head.
Below their heart.
Wait, really?
So if they're standing, we should try to lay them down.
Ideally, yes.
Or if they're sitting,
Yeah.
you can help them lean forward with their head.
Between their knees.
Okay.
This helps improve blood flow.
To the brain.
So it's all about restoring that blood flow.
Exactly.
That makes so much sense.
It's amazing how,
These simple actions
Yeah.
can make a big difference.
when you understand the why behind them.
Precisely.
Now, on the topic of seemingly simple things.
Let's talk about wounds.
Okay.
I think we've all experienced our fair share.
Of cuts and scrapes.
Oh, for sure.
But even those minor injuries
Yeah.
require the right care.
To prevent infection.
Absolutely. And
I bet even with something as basic as wound care,
yeah.
there are probably things we think we know.
But we're doing wrong.
Right, right.
So walk us through it. What's step one?
Well, before you even touch the wound.
It's crucial to wash your hands thoroughly
Okay.
with soap and water.
Right.
And if you have gloves handy,
Yeah.
even better.
This minimizes the risk of introducing bacteria into the wound.
Makes sense. Clean hands.
Clean wound, right.
Exactly.
What about rinsing the wound itself?
Yeah, so if it's a dirty wound,
Like a scrape from the pavement.
That's right.
Rinsing it with cool running water
okay.
is a good idea.
But if it's, a small clean cut,
Mm-hmm.
you can skip that step
Gotcha.
and go straight to covering it.
Good to know. So it's about,
Applying common sense
yeah.
based on the situation.
But what about those times when the bleeding seems more serious?
I'm thinking beyond your average scrape here.
What should we do if we encounter someone with,
Heavy bleeding.
that's when those first aid basics
Really come into play.
Okay.
First, try to stay calm.
It's natural to feel panic.
right.
But remember,
Yeah.
your composure can actually help the injured person as well.
Easier said than done. Right. But okay, staying calm.
That's next.
Safety first.
If there's any risk to your own safety,
Right.
like broken glass,
Or a dangerous environment.
okay.
Address that first.
If possible, wear gloves
Okay.
to protect yourself from bloodborne pathogens.
Right.
Then control the bleeding.
Okay, that makes sense.
So gloves on.
And then direct pressure.
You got it.
Apply firm and direct pressure to the wound
Mm-hmm.
using a clean cloth or sterile dressing.
If nothing else is available,
Yeah.
even your bare hand will do in a pinch.
Right.
But remember to prioritize your own safety.
Of course.
No,
Of course.
possible.
Okay. Applying pressure.
Got
Is
it.
there anything else we can do?
While applying that pressure, or
Are we just waiting for the bleeding to stop?
our sources are very specific here.
Elevating the wound
Okay.
can also help slow down the bleeding.
Okay.
If it's an arm or a leg,
Mm-hmm.
try to position it above the level of the person's heart,
So we're applying pressure.
elevating the wound,
Anything else we need to be doing simultaneously?
keeping the person warm, and calling 911 for emergency medical help, of course.
Right, of course.
So it's obvious steps, but
It's amazing how quickly they can slip your mind
absolutely.
when you're in that high stress situation.
It's also important to remember,
Yeah,
even if the dressing soaks through,
right.
don't remove it.
Oh, okay.
Just add more on top
Okay.
to maintain that pressure.
That's one of those things I always forget.
But it makes sense though. You don't want to like
Disrupt the clotting that's hopefully happening underneath.
so pressure, elevation, warmth.
And call for help.
You got it.
Got it.
Now let's move on to a situation.
That's a bit more common.
Okay.
And often happens to catch us off guard.
Okay.
Nosebleeds.
Oh no.
Everyone has a story about a time they had a gusher. I remember once in elementary school.
I bet. But you know what's interesting about nosebleeds?
What's that?
Most people, they react in a way.
That actually makes the situation messier.
Really?
Yeah.
What do you mean?
Think about it. When someone has a nosebleed,
What's like that instinctive thing to do?
tilt their head back.
Exactly.
And while it seems logical, right, to
Yeah.
keep the blood from, like,
Right.
dripping out.
That actually sends it down the back of their throat,
Oh,
which
yeah.
which isn't ideal.
No.
So what should we be doing instead?
Have them sit down
Okay.
and tilt their head slightly forward.
Okay.
Okay.
Gravity's working in our favor,
Right.
and the blood drains out the nostril.
So leaning forward, not backward.
Exactly.
Got it. What about pinching the nose?
Is that still like
Absolutely.
Good move?
But again, there's a bit of a technique to it.
Okay.
Imagine a line across the bridge of your nose,
Mm-hmm.
right, where that soft part meets the hard, bony part.
That's where you want to pinch,
Okay.
right below that imaginary line,
So not up high.
but like a bit lower down.
Exactly.
Pinch gently but firmly,
Yeah.
and have them breathe through their mouth while you do this,
Mm-hmm.
and hold that pressure.
For about 10 minutes.
10 minutes. That seems like a long time.
It is. It's all about giving those blood vessels
Mhm.
time to clot properly.
Okay.
If you release the pressure too soon,
Yeah.
the bleeding might,
Start right back up again.
Right.
After the 10 minutes are up.
They can,
Yeah.
gently release the pressure.
Simple but effective.
I'm starting to realize that
A lot of these like
Yeah,
first
yeah.
aid techniques.
are really about
Mhm.
understanding the why behind them.
Yes.
It's not just about
memorizing steps.
Right.
It's about knowing
why those steps work.
precisely and that
They
understanding
make all the difference
Right.
in those critical moments when you.
to act quickly and confidently.
I couldn't agree more.
I think
All these different scenarios.
Yeah.
It really highlights something,
What's that?
you never know.
When you might encounter a situation
Yeah.
where someone needs help,
Absolutely.
and being prepared, and even this basic knowledge.
Could potentially save a life.
Absolutely, knowledge is power,
Well said.
especially when it comes to health.
So as we wrap up our deep dive,
Into medical emergencies. Just a reminder that this was a crash course.
and it's always best to seek,
Professional medical advice and training.
couldn't agree more.
If you want to be
Fully prepared
Oh.
as you go about your day.
Yeah.
Here's a thought-provoking question.
Based on what we've learned.
Okay.
What's one thing?
You feel more confident about handling now.
And what's one thing?
You'd want to learn more about.
Keep that in mind.
And maybe it'll inspire you.
To take that next step
In your own kind of
preparedness journey.
love it.
Till next time, stay curious.
And stay safe.
It's interesting.
I often think of medical emergencies as these
Like big dramatic events,
Right.
But as we've been talking about,
They can
it's
be.
surprisingly common.
They really can.
And sometimes
It's the simplest actions
that make the biggest difference.
That's so true. And
And what I find really empowering about
yeah,
this knowledge,
is that it takes away that feeling of helplessness.
right,
Instead of
panicking, right,
or freezing up,
Yeah.
you have a plan.
you know what to do.
Exactly.
Yeah.
It's like that saying.
Knowledge is power. Absolutely.
So to wrap up our deep dive today,
Just a reminder.
this was a starting point.
If you're like,
Really serious about
Yeah.
being prepared for medical emergencies.
I highly recommend
Seeking out professional training.
of course.
First aid course can equip you with
Even more
Yeah.
practical skills.
Absolute
and confidence.
and remember,
even though we covered a lot of ground today.
yeah,
The most important takeaway
is that we all
of
need
the potential
okay,
to be those everyday heroes.
who step up and
Well,
help when
right.
it matters most,
You don't have to be
doctor or nurse,
Right.
to make a difference.
so well said. So well said.
So as you go about your day,
Here's a thought-provoking question
Okay.
based on what we've learned today
What's one thing
that surprised you
and what's one step
you can take to feel.
even more prepared
Yeah.
for a medical emergency?
Keep those thoughts in mind.
And
Right? It'll inspire you to take action.
I love it.
Until next time.
Stay curious.
And stay safe.